Chiropractic is thought of as generally safe with a wide range of benefits that come along with it. Adjustments are usually come with decrease in pain, decrease in musculoskeletal conditions, as well as an improved overall health. Just like any other medical profession, it's important to understand the risks and the health benefits involved in both of these. So it's important to talk to your patients about how chiropractic adjustments can be very beneficial when it comes to reducing pain, especially when it comes to acute pain or even long-term chronic pain. Getting joint motion back into those spinal segments is going to be really beneficial for decreasing pain in most patients. So explaining to them how when our body stops moving and we stop getting motion in those segments, our bones start to get really tight, our ligaments start to try to get us to stabilize, and when we stabilize, it decreases motion. Decreased motion causes pain. This pain causes problems and can progress to be worse things in the long run. So increasing mobility with chiropractic adjustments as well as exercise is going to be really important for these patients, and it's going to be important for us as their healthcare professionals to explain this to them. However, just like any other medical profession, our care comes with some risks. These risks can be things like serious injuries, spinal nerve injuries, spinal cord injuries, herniations, worsening of their existing conditions, increasing their pain, as well as a ton of other things. They may have temporary soreness. They may be a little bit uncomfortable when they get out of the chiropractic office. Over time, those that your body starts to compensate for the things that are going on in. When it compensates, we get pain. And so when we go back to normal, our body says, wait, I've been compensating for so long that compensation no longer hurts. And then when we go back to our normal state of being, we get pain. So it's important to talk to those patients about how when we realign their body, there could be potential for problems. It's also important that a lot of patients may come into your office asking about if you're going to cause a stroke or if chiropractors cause stroke. Chiropractors in general do not cause stroke, but there is always the risk of stroke or anything like that with patients that have history of heart disease, stroke, cardiovascular disease, high blood pressure, and things like that. Because when we make the walls of our arteries thinner, we always increase the risk of stroke. So making sure that we're taking proper history and taking care of the patient and explaining everything to them is going to be the most important thing to the patient. There are other risk factors such as disorders that require modification of techniques. One of those is going to be a stroke. A stroke is going to require little to no rotation. So they can do lateral flexion, but no rotation. So they're going to do things like toggle, activators, stuff like that. We also have things like osteoporosis and pregnancy that require modification of our adjustment type. Pregnancy is going to require things like a Webster technique that's going to have a lot more muscular imbalances. And osteoporosis is going to require a light force adjustment, either instrument assisted or manual. Either way, these are going to be really important for you as the doctor, but also the patient to understand. So explaining these things to them is going to really make their lives a lot better, and it'll make them really understand how important chiropractic care is in general and for the rest of their lives. Then they might actually stick with you as a patient to increase their health overall for the rest of their life.